Hi, this is Susie Jekyll,
And this is Ruth Hunt.
and this is a slideshow about chromosomes and karyotypes. Please take notes and be ready at any time to repeat this information on a quiz. A karyotype is an organization of your chromosomes to see if there are any issues. You should have the right number, 46, and you should have a matching pair of every single one except for maybe your X chromosomes. Each pair is called homologous. This means similar, not identical. You get one homolog from your mom and one homolog from your dad.
This is a karyotype. Technically, it is called a metaphase spread. As you can see, all 46 chromosomes are right here. This comes from metaphase of mitosis.
This is the chromosomes after they have been sorted from the metaphase spread. Take a couple of seconds and write down how you think they've been organized. The first way the chromosomes are organized is from largest to smallest. Chromosome 1 is the largest, chromosome 22 is the smallest. We'll talk about the X and Y in a minute. The chromosomes are also arranged by matching banding patterns. The patterns of dark and light on the chromosomes are matched up. The other way they're arranged is with the centromere, how the sister chromatids are attached, arranged on the dark line. The sex chromosomes are the last pair, or your 23rd pair, and if the person has two X chromosomes, they're female. An XY chromosome means a male. This is a normal female karyotype for a human being because there are 46 chromosomes.
Take a look at this karyotype. Do you see anything unusual? Take a few seconds to examine it closely. If you notice that the 21st chromosome has 3 chromosomes instead of 2 chromosomes, you are very observant. This karyotype is called trisomy 21. Tri for 3, somy for chromosome, and 21 for on the 21st chromosome. It results in a syndrome called Down syndrome.
This is Holly. Holly has Down syndrome, or trisomy 21. If you notice, she has certain characteristics that are usual in all patients with Down syndrome. She has very wide set-apart eyes. She has extra skin on her eyelids. She has a very high forehead, and her ears are set very low on her head. Some things that you can't see are the hole that Holly was born with in her heart that she's already had surgery for when she was very young. Also, kids with Down syndrome might have digestive problems, skeletal muscular issues, nervous disorders, and a myriad of other things. Holly is not as afflicted with her Down syndrome as some other kids have been.
This picture shows Holly's flat facial profile, which is very characteristic of children with Down syndrome.
How old do you think Holly is, looking at this picture? She's actually 4, so you can see she has a very small stature, and she always will.
Holly is 4 years old in this picture, and she is developmentally disabled. She plays very well with her 9-month-old sister, and probably has the mental capabilities of a 9-month-old child.
Look at this karyotype. Do you see anything wrong? You might have said that there's a missing 21st chromosome.
Where did that 21st chromosome go?
If you look more closely, you will see that the 14th homologous pairs of chromosomes are not similar. The one on the right has a little extra on top. That is your 21st chromosome. This is called a translocation. What do you think this person looks like?
This is the individual who has the karyotype from the previous slide. Despite the 70s fashion, he is actually normal. He's balding, which makes him really handsome, but he's also very normal.
The gentleman in the previous slide is normal because he still has 46 total chromosomes, even though a translocation occurred where the 121st chromosome was attached to the 14th chromosome. The total is still the same. This is why he is totally normal. But let's see what that can do for their offspring.
This is Stephen. His father had the translocation. Stephen has a mild form of Down syndrome. Let's take a look at his karyotype.
This is Stephen's karyotype. Take a look at it and tell us what you see. At first glance, it looks as if Stephen should not have Down syndrome at all. There's a homologous pair in every slot for a chromosome. He's male, he has XY, he has 2 of every other chromosome, except take a look at the 14th chromosome slot. The chromosome on the right is a little bit longer, long enough exactly to match the 21st chromosomes. This individual, this is Stephen, remember, has trisomy 21. With a translocation, the symptoms of Down syndrome do not show up as significantly as Holly's form, where she had 3 unattached 21st chromosomes. But this is still Down syndrome. So, if you have a translocation, but you still have 46 chromosomes, there's no effect to you. You can, however, pass too many chromosomes on to your offspring.
This is the 5th karyotype we've looked at. Take a few minutes and compare it to the first karyotype and think about what's different. Did you notice that there are 3 chromosomes for the chromosome slot for number 18? So this is called tri for 3, somy for chromosomes, 18 for the 18th chromosome pair. So we call this trisomy 18. It is also known as Edwards syndrome.
This is Kevin. Kevin suffers from the symptoms that are caused by having an extra 18th chromosome. As you can see, he has some major physical deformities. His ears are set low on his head, his eyes are spread far apart, he has the higher forehead, and you may not be able to see it as well, but his head is very narrow, making his palate very narrow. The palate is the roof of his mouth. This makes it impossible for him to nurse, and so he has to be fed from a specialized bottle. Kevin also had heart defects, digestive system defects, and you can see his skeletal muscular defects on his arm. Here, Kevin actually is about 2 years old when you can see how very, very small he is. Most kids with trisomy 18 or Edwards syndrome do not survive past their first 6 months of life. Kevin passed away shortly after this picture was taken.
Ouch! This looks painful. What's that guy doing to that pregnant lady? Well, what he is doing is he's going through a procedure called amniocentesis. He has stuck a needle into her abdomen. I'm having a hard time pronouncing this. Anyway, it's going right into the womb, and he's taking some fluid that has some cells of the baby out of the woman's womb. From this, they will take those cells, culture them, and then find some cells that are in metaphase. They'll make a metaphase spread out of that and take a karyotype of the child.
The cells collected from the amniocentesis are grown here, and then, if any are in metaphase, the karyotype can be created from them.
And here's the technician looking at the metaphase spread and doing the karyotype. So, this is the end of our show. Please make sure you bring your notes and questions to class. Remember, you may be held accountable for the information in this presentation.